Here we'll draw the four muscles of the pectoral region and axilla. These muscles act on the pectoral girdle. Spinal nerves from C5 to T1, the brachial plexus, innervate them. To begin, start a table. List the muscles of the pectoral region and axilla: subclavius, pectoralis minor, pectoralis major, serratus anterior. We'll start with the three muscles that both arise and insert anteriorly. First, define medial lateral in our diagram. Then draw the bony structures: the manubrium, body, and xiphoid process of the sternum. We label the manubrium and body because these are important muscle attachment sites. Next, draw ribs 1 through 8. Recall that the 8th rib attaches via costal cartilage to the 7th rib. Draw the body of the scapula, which lies posterior to the ribs. Our view of it is obstructed. Draw the coracoid process, which extends anteriorly, the acromion, which projects anterolaterally, and draw the clavicle between the acromion of the scapula and the manubrium. Lastly, draw the distal humerus, the shaft, head, greater tubercle laterally, lesser tubercle medially. And between the tubercles, draw the intertubercular groove. Now draw the muscles. First, show that subclavius, which is a small, slender muscle, arises from the first rib, specifically where the bone and costal cartilage meet, and inserts on the inferior surface of the clavicle. Then show that the triangular-shaped pectoralis minor arises from the 3rd, 4th, and 5th ribs, and inserts on the coracoid process of the scapula. Superficial to pectoralis minor, show that pectoralis major arises from the medial half of the clavicle and the manubrium and body of the sternum, as well as from the first 6 costal cartilages, and inserts on the intertubercular groove, specifically on its lateral lip. Then show that pectoralis major can be divided into a clavicular head and a sternocostal head. Now redraw the bony structures of the axilla so we can draw serratus anterior. Draw the sternum, clavicle, first 8 ribs, the scapula with coracoid process and acromion, and the distal humerus. Then show that serratus anterior arises from the first 8 ribs, specifically from the lateral shafts, and inserts on the medial border of the scapula. Serratus anterior wraps around the thoracic cage to form the medial wall of the axillary region. Its saw-like appearance anteriorly lends to its name, as serratus means saw. Now start a table to organize important features of these muscles. From left to right, write the following headers: muscle, origin, insertion, and action. Indicate that subclavius arises from the first rib or costal cartilage, inserts on the inferior surface of the clavicle, and depresses the lateral end of the clavicle. Note that its name, subclavius, indicates its location. It lies under the clavicle. Then indicate that pectoralis minor arises from the 3rd, 4th, and 5th ribs, inserts on the coracoid process of the scapula, which it depresses and stabilizes. It also elevates the ribs during deep inspiration. As we march through our table, let's keep track of some important clinical correlations. Denote that pectoralis minor overlies key clinically important neurovascular structures. Now indicate that pectoralis major arises from the medial half of the clavicle, the sternum, and first 6 ribs. It inserts on the lateral lip of the intertubercular groove of the humerus, which it flexes, adducts, and medially rotates. This large muscle comprises the bulk of the anterior thoracic wall. Denote that the cephalic vein traverses superficially along the superolateral border of pectoralis major. Lastly, indicate that serratus anterior arises from the lateral aspect of the first 8 ribs and wraps posteriorly to insert on the medial border of the scapula, which it abducts and protracts. It also stabilizes the scapula against the thorax. Throw a punch. To reach anteriorly, you have to activate serratus anterior. Thus, it's sometimes referred to as the boxer's muscle. Denote that failure of serratus anterior to activate causes a winged scapula, in which the medial border projects posteriorly. This often occurs via injury to its innervating nerve, the long thoracic nerve. This concludes our diagram.